If you've ever tried to make a change to the way that you eat, you'll probably know how hard it is to make that new habit stick, especially with busy working lives and families, and even sometimes just getting through those hard days where you don't want to do your new habit and you fall back into your old ways. We've all been there, it's really common. So today we're going to talk through how making some small changes is achievable and how it can help us all. You may have heard of cognitive behavioural therapy, or CBT, but did you know that it can actually be applied to the way we eat and help us to be healthier? So today I'm joined by lead dietitian Niamh Hennessy. I'm going to be talking a little bit more about how CBT can actually help with reaching your healthy eating goals, which might be quite new to a lot of people because we tend to associate it more with mental health conditions. But I think the first thing I'd like to say is that I think it's really important when people are trying to make a change that they're not too ambitious, they make it achievable and they do it in a way that is being kind to themselves.
Yeah, we really try and encourage people to be kind to themselves and to not make big changes too quickly. We normally look to 1 to 2 changes each visit and small things that they can achieve so they can look at it from a success point of view. If you find you start off slowly and you have some success in the first couple of weeks, you're more likely to continue further on into making and keeping those changes.
Okay, so it's all about making small achievable changes that you can build on rather than big ambitious changes that you're already setting yourself up to fail. Let's explain a little bit more about what CBT is.
So cognitive behavioural therapy, it's a type of thinking therapy. As you said earlier, it's mainly used in mental health, but we do use it in clinical practice to help people change eating behaviours. It's really helpful when you're looking at barriers to change and getting people to be open to different suggestions. It's really important that you're bespoke to the individual and you make it work around their diet and lifestyle.
So is it somewhat like sort of almost retraining the brain in a way that it becomes easy to continue this healthier habit?
It is, but it's also that positive reinforcement. So it's encouraging people to continue with changes, or if they have a blip in their pathway.
Which we all do, don't we?
Yeah, it's very normal that they don't give up altogether and finish the bar of chocolate or the packet of crisps, that they enjoy a small amount of something and have everything in a balance. If they do fall off a small bit of their plan, that they're going straight back in at the next meal time rather than saying, oh, I'll start again on Monday.
Is CBT for everybody, or would you say there are some people who can benefit from using this technique more than others?
So CBT definitely isn't for everyone. A lot of people do find it helpful. The main people that find it less helpful are those with severe mental health problems or someone with a severe learning disability. It doesn't mean that they won't use elements of it, but they find it a bit more challenging to work with.
Okay, so it does require some element of sort of flexible thinking.
Yeah. Also, for some people, they find it really difficult if they're very self-critical as well. And a lot of us can be critical, but it's looking at the extremes. If you're very obsessive about things, you might struggle a little bit with CBT because there's a certain amount of releasing the control that you're having.
And I think that critical thinking is a really important thing because I think for all of us that we do tend to be self-critical, don't we? And if we have set ourselves a goal such as never eating chocolate again, which is too ambitious, and then we have a small piece, we can feel like, well, that's it, I'm throwing in the towel, I'm a failure, and we can use really negative self-talk, which doesn't help. So is CBT partly about changing those thoughts then in order to change our emotions and our behaviours?
Yeah, it's looking at retraining and it's looking at how we view our actions, and it's helping people to say, actually, having that small bit of chocolate, did you enjoy it? Was it worth it? And for a lot of people, it's yes. So it's saying, well, it's fine to have a small amount, but don't eat the big 500-gram bar of chocolate. And it's everything in moderation. And it may be that actually getting rid of the chocolate isn't right for you. Yeah,
if chocolate's your most favourite thing in the whole world, maybe work on the crisps or whatever else it is that you're not that fussed about. Okay. And are there any other top tips that you can share with us, apart from CBT, that can really help people to make these changes and stick with them?
For me, I think the key thing is being organised. If you're organised and are well planned, so having a wall planner in your kitchen that plans out the week so it keeps you on track, you're less likely to change your mind and go back to old habits. Also using your freezer, so bulk cooking is a really key thing. Having a backup plan, so if you're not able to have your ideal breakfast in the morning, say homemade porridge oats, that you would have an oat-based muffin maybe in the freezer, or you might have a cereal bar and a piece of fruit. So you're still staying on track, but you've not done exactly what you wanted first thing.
It's almost preempting that you will fail from time to time, and well, we shouldn't even use the word fail really,
No.
but sometimes it's just not always possible to stick to the plan, and having thought about that and prepared for that.
Life is busy, everyone's got a lot going on and nothing ever happens according to plan all of the time. So it's having these coping mechanisms in place, and that's where CBT is really good at helping you to explore your options and explore your thoughts and how you feel about the food you're eating and how you're living your life.
So a small number of smaller changes that are achievable, and also having a bit of a backup plan for when it doesn't work.
Exactly.
Sounds great. Thank you, Niamh.